when you exercise, you feel better, right? I mean, you just do. You feel so much better. You
Yes.
got the endorphins, and it's great. But in contrast to that, the disease can take away so much,
Hmm.
right? It can take away your sight, or I mean, it just so many. You just never know, right? Day to day.
Right.
So you have this contrast. So my question is that deals a lot with psychiatric care as well.
Hmm.
And so I was wondering, as a PT in dealing with individuals with MS, do you also work with some of their psychiatric care folks, or how do you? What's the
We
relationship with that?
physical therapists are not mental health providers. We do get a fair amount of that education in our schooling, and we are motivators. We are life coaches. We are cheerleaders. Um, but we don't have, the full blown mental health skills that other people will have, and we cannot prescribe medications. With a patient's permission, if we are seeing that they are possibly slipping into a depression or just for weeks on end, even after, say, an exacerbation has quieted down and they've regained strength and functional abilities to where they were, and they're just not doing anything that they used to do or that we suggest that they do, we may ask permission to, if we know they're seeing a mental health provider, we may ask their permission to speak to that person. If they have never seen anybody, hopefully we as the healthcare provider know the clinical psychologists, counselors in our area that deal with people with MS. So, and not letting weeks and months go by, but boy, staying on it quickly. Most people, myself included, and I think our panel here, we know what it does for us. We love it. Do I want to do it every single day? And again, I'm not that chipper every day about it, but I do it. I'm glad I did it. I use it as a huge part of my social life, which helps me. Other people, they may not want to talk to anybody. They don't want to see anybody. They put their big old ugly T-shirt on and um, uh, yoga pants, and they go to the game room and they say, like, do not come down. Just don't disturb me. I like to do this by myself. Other people, that's the only way they ever get out to do something physical is with another person. The buddy system, it can be a huge social thing in your life, but you've got to find it if you want it to be, if you don't want it to be. I tell everybody what works for you. If it works for you, it works.